Hello, lovely viewers. I welcome you all to today's episode of Health Matters. Indeed, your health really matters. As we started discussing last week in our previous episode, we talked about sickle cell diseases. We got to know what it was, how it is inherited, and some myths around it. In today's episode, we will look at what triggers sickle cell diseases, the treatment, and some management and preventive methods for us all to apply to save ourselves and those going through the crisis. We are joined on this episode by Dr. Isaac Edujemfi, a medical officer at Kwesi Hospital. Viewers, before you help me to welcome our guest for today's episode, please don't forget to like, share, and subscribe to all our social media platforms so we could increase sickle cell diseases awareness, because lack of knowledge will surely cause us to perish. Join me as we welcome Dr. Edu for today's episode. Doc, you are welcome.
Thank you.
It's really great having you once again.
Yeah, really great.
So as we started last week, we are still continuing our discussion.
All right.
Last week, we talked a lot about what it was. Today, we are looking at the triggers, what brings about sickle cell diseases. So please, my first question is, what triggers sickle cell diseases to come?
Okay, so I would say what triggers the crisis. Okay. So the disease is already there, like
okay,
disease is all what it has, so the crisis. So the crisis, you know, with what we said earlier on. Let's take one, dehydration. So dehydration will trigger a crisis because already mojanang or a sickle or let's say a shape like, as we said, that sickle or let's say that crescent moon. Is not able to get that laminar flow na you can last week. The why sickle na wako shishe joint in one pakono feel pain. So dehydration will cause it because it need blood to move. They need water to move. They need fluid to move. In this our enemies were dehydrated. Your blood becomes viscous. Today cocoa pampa. So the movement is not very good. In Tasha, obi wa ho say onum nsu papa, odu baby what else need to yen yo. Chere moja ntum onko na adwen ho ye. So the body is telling the person that they and obi a our sickle cell the obetum we nya crisis or we nya crisis na be a dehydration. Already now moja na a sickle ontum ko wa clock wa ko hihye joint na enum nsu ye no. So that will let you get the crisis. A biome infection. So we normally tell infection to say malaria, getting infected with malaria or any infection. And that was when it's very, very, very serious. So you advocate on shenu the like obe cover no ho obe that net team and other need them like obe spray ho before those things. And it be so like obe call high altitude. I call high altitude already now moja na or red blood cell or a sickle. In the oxygen now all the cause cells all the organs or food. But also I call very high altitude. At a very high altitude, the oxygen concentration is very low. In that area, in Kenya, Uganda, I don't know long distance high athletics. What those long distance where because it's very high. The oxygen concentration of chin compared to what by Yanasiana. In the way you're training now on 1 year, what by Hana easy crime or they tend to get more, so they'll just go. The Obia or sickle or high places of high altitude that it tend to have the crisis. And a biome stress. Stress too can bring about like the crisis. Stress of any form. Which more the crisis or the so let me say these are the few like or bring about the crisis. In the we also let's say we tell them to dress well, to cover mostly the chest. Me dear, just to cover up so that in pharma on kono them acute chest syndrome na you can obey infection like pneumonia na then na also in same baba no. So these are some of the things that we are on the one crisis urbano.
Research also shows that when there's fluctuations in the temperature, you know where they no why so
yes, no more there na already now you cry no you feel it. No. So they tend to feel the cold because of the air no. So if you are not covered enough, then you tend to
Okay. See, let's try and then do the needful. Cover ourselves, especially now that our weather is not really predictable.
Sure.
I might go through crisis.
Sure.
So please, my next question is, what treatment options are there for such people?
Okay, so treatment. Now we have the treatment. Like let me say, the number one treatment now is a bone marrow transplant. So that one, what is bringing the sickling, those cells, those sickle hemoglobin, on in a science or a medicine, the bone marrow, then they replace it with another, but it's not easy. In Ghana here, we don't do it. I think US they did it on a girl, so it's not common.
It's not really common.
It's not even common in the US, like those states. It's not really common, and it really entails much. Like nobody isn't. So with our setting, we tend to give them some drugs. We put them on folic acid, vitamin C, zinc, like something to just help build the blood. Obey appetite, obey the like obey. Now we also have the hydroxyurea. So the hydroxyurea, it helps in like keeping the shape of the cell, so that we don't get more of the sickle cell. So we have, I think now that is a bit of a breakthrough medication now in preventing them into going into crisis now. But on the you go otherwise and do what we talk about as in bringing the crisis now. So we admonish them taking fruits, the vegetables, the green stuff, the contomere, the ayoyo, like local foods now. Green, we help. Yakawundi, chefuanizi, and nam. They should stay away from those junk foods. Those sorry, I don't want to mention some of the food. Those junk foods. No, then you eat healthy. If such nipa no yedama obwano in preventing them getting the crisis, because when you get the crisis, I want a pain like it's not easy. So if you do these things, you are yes.
So what are some of the lifestyle habits that will help somebody to stay healthy?
So on the year can with the nutrition, the like exercising with it, what you said last, with the exercising with staying hydrated. So in the mofuma no krano you catch one parent who school then when the parents should tell, that's why schools now they ask you to do those labs. But parents do lab no question no, but me I catch you there because they need it so that they will know what is wrong with your kid in case no crisis be another BB because of the condition, and then they will know how to tackle it quick. Indeed, over a secular or institution the bag, my catch the school is away. And always now when in your war, the marble front wash your news Naziban, even Naziban it might be different from what the other kids eat. You, the mother, or the parent can go the extra mile of cooking like your own food. They will addition a lunch bag. It's managed or healthy. Ni kontombre ni you like ni vegetable salad be ni fruit salad. I and kama. Is that man? No, I think it will help them with the exercising, as you said, then staying away from stress. Ebe live healthy, like what environment in Tontomon Korean, because in Tontomon you tend to have the crisis more.
So please, wait. Unless you go through your condition, you know that if you don't eat well, if you don't take in enough water, if you don't exercise, just as Doc mentioned, that is when you have all these crises. So please, those of us with the conditions, let's help ourselves so our family and our loved ones can all come together and help us so we can live healthy. Have it in mind. Let no one deceive you that if you have sickle cell disease, you can't live long. You can live long. You can live your normal life. A bit myself, a bit myself, only that our word, make sure you have full consciousness that you won't go beyond so you don't harm yourself. Doc, back to you once.
All right.
Is there anything you'd like to say before I ask my next question?
Oh, okay. You let's move on.
I still should ask my next question. Okay. So please, my next question is: what are the long-term complications that can happen?
Long-term complications. Maybe one to the parent of a kid. Depression. You the parent, you'll be depressed.
Okay.
Okay. You share here then. Okay, then I've been telling you, and then I call more for my day. Then I heard I want the audience to tell me about now. Yami and be mana our jail no cry or river. A biome to Abofrano. Abofrano between your stroke because of sickle cell. Because the blood will clot. Because so when your crisis no about hospital, depending on the type of crisis no what they are, if it's vaso-occlusive, want to hydrate. You didn't sinido, you man like once you say them on a calculated per the body weight, a man intended just to help so that it's no connect system anymore to relieve the stack, more general stack to relieve it so that it will just flow. So you make sure BBR or did that now queen. So indeed said them clotty say yen through them alas they care about stroke no. If this clot should dislodge from where it is embolics, no corner dream one, you can have a stroke. So you can easily have a stroke because of that. And a biome obiti de behin. Waiting will lose the male function because of sickle cell. Yes, they have something we call the priapism. When you're erection without any sexual enticement. Ohun besie bi anane ho kani bi amba no nche na oma no ho sorry. Azina no was because of the crisis. Indeed, the blood is sickled into the pineal like vessel ni mu na wakoka no ontumi mba no nti stay and no stay because our erection has to do with the flow of blood not alcohol but what you know is not the brain sensitizing the I've seen this I want to do something then it sends the message then blood flows but what because of the crisis then when it comes it's very dangerous. So when they come in Yabute, we have things we do to relieve them, but all has to be time, like or a time bomb. So oya nurture, moja no, moja no, eba moja nebi oya oba to hydrate the man just to relieve the pressure there. So okay, koda na still you end up losing it. Yes. So is that dangerous? Is that very, 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 very dangerous? You've seen so many.
Recently, I heard of one.
So many. They come. If we also about like obe lose with why erected neighbor or nant one or a bibina or their copy unconscious. It can have pineal fracture. Waiting we boo then that be it. It's on your face I go. You know we are able ne nan ho na we nya chronic ulcers. One now all because of this vaso occlusive crisis maybe now then others too they who near from why do she the spleen why about the liver no so about the when you organomegaly like a whole lot. So on here BBA years ago and even in the bone it can even affect the bone. They tend to have something called osteomyelitis like bacteria feeding on the bone and the table we want a joint. There should be a word no is serious part one show one who do you know. One on nanto style by orthogunando bionia orthogunando ha and it's mostly happen at the head of the femur or the humerus bone. Young bone or it one and son wing and mostly at the joint. One and nanto why style. It's all because of this. And I want you mostly actually one parent and I also know they didn't take those precautionary measures very well. Because you have precautionary measures, we have some antibiotics, we put them on, then those folic acid, the vitamin C, the zinc of it, just to help with it, then the good eating habit near them. You are good to go.
So Doc, how about anemia?
Like yeah, they tend to have chronic anemia because them can one red blood cells no lifespan no. Even with research now, even the 19 no like it's 10 to 20, 30 days. Like now research about it, that's what they are saying. Like our form cry, so they tend to have multiple anemia. So when they come to the hospital, depending on the the crisis that they have, we do transfusion, eman moja kakra, just to help up so that the organs won't be shut. They will when you have kidney issue, when you have heart issue, when you have liver issue, because and when you have any problem, even with the brain,
yes, can it cause blindness?
Yes, it can cause, all because of sickle cell. Yeah, so it's not a plaything. Then, you can just die. You can just die, and it's so. And most of them, is when they tend to have the acute chest syndrome. When they get infected with pneumonia, when you're pneumonia, then they come with breathing issues. When they come like that, you are not like apt with their treatment or their management. You just leave quick. You just leave.
Thank you so much. Before I come to you, Doc. So you see, there's a saying that love is blind. If we should allow love to blind us, it's going to kill us. But it's not supposed to be that. Love is sweet, but let's not allow the sweetness to let us have blindness or anemia or all the complications that Doc just mentioned. You just assume that being partner before you even get married and your manhood is already gone. I mean, where the depression is like, no matter how we treat it, unless God intervenes.
Sure.
Because it's not going to be easy. Your marriage is at risk and your whole life will seem like it's on pause. So please again, let's try and know our genotype even before we start dating. I'm still advocating for this. No genotype test, no dating, to save ourselves from all these stress. Back to you, Doc. So please, my next question is, how can regular follow-ups help us to prevent all these complications that we've mentioned?
Okay, so you do the follow-ups. So the follow-ups are mobile or more laughs near there. Then we see how the person is doing on the medication. Then we also help in building up the blood and also helping the how do you call the red blood cells lifespan. Yeah, dear. So when they come, if you need nipa na obey no, this was the state, and now this is the state. Are we making progress or we are retrogressing? Then you also advise the parent as to the way who know then what they have to do. Because some of the parents, then you have a way of okay, then we do this along with the nutritionist.
Okay.
Because they will have a
Meal plan.
timetable or let's say menu they give to the parent as to the menu, what they have to inculcate in their meals with their lifespan, with their red blood cell, so one checkups no, it's very very necessary
Very
because
necessary.
bebree na ebe obenya crisis pa obeba no ebe bisa no na one call checkup one ba on bed na na because they do never we know how to top up ede yi beka ho eyi aba oh did but ebi wo ho mba nto obeba no aba is severe crisis. They have to rush up and help out quick. And mostly when they come in crisis, because we might not know what triggered the crisis, we tend to treat so many things. We treat malaria, we treat infections, we are giving the fluids, we are managing the pain. Yeah, there just to everything because we don't want but so in our setting we just go all out, just give everything. Then you just help out. Then actually then you do what you call the serial urine collection, bottles, name or sanchigum. Na eshe, okay, this is like you label the bottles, ne eshe. So as all connect, okay, obe no deep. Since you are all you okay, then you know that you are progressing. Go ahead with that.
So this tells us that follow-ups is really important. Obeboama is saving life. And as he's saying, the timing, follow-up is good, but the timing also, we should do well to pay much attention to that. Thank you so much, Doc.
You're welcome.
So when you were speaking, you said for the family or the parents, there's depression. And it's like the whole treatment plan, our family really do play a role.
A big role. A big role. They play a big role. A big role. So we need them to tell them. So nutrition or not only film, out like we tell them the medication to take, the food to eat, and all that. So they play a major role because abufano ya onya crisis no year. Ujina o maame na papa no do. So eba e catch ye dey then so it's the whole family involved. Yeah, it's not a child's play. It's not a child's play. Like if you are here can oh sickle cell yeah be the abadin but it's not a child's play. Yeah.
It's a very serious
Very
condition.
serious condition. Very serious condition. That can easily take your life. We've lost people because of that, even at our place. Yeah.
No, most of when you lose them, it's really sad.
Very sad. Very sad.
See the parents praying, "Mommy, me too, me It's true. Nyankopon, he will surely do it. But you know, we don't have to put God at a tight where it's there. We shouldn't do that. If we can prevent it,
We shouldn't get there. Sure.
Shouldn't let it get there.
Sure.
So please, it is best way. Yana phone so betim aboa hena ageda won so wo nimdi a ofa sickle cell disease si eho ansa wetim wo aboa hen na yen so yenyan ayaresa no nti mesre woma yen nyina yembom na yen su ade yembom yen fa mbo aye no ho whether you are living with somebody with this condition or not, whether you have some, let's learn together. Don't forget to like, share, and subscribe so we could increase sickle cell awareness, because this is one of the serious medical conditions that is taking the lives of a whole lot of people. So back to you, Doc. My last question for you before we end today's discussion. What is your last words for our dear viewers out there?
Okay. So my last word is just simple. Please get tested. Get tested. Know your genotype. Know your genotype. Yeah. So maybe you can even advocate to have some shares like, do you know your genotype? Like, you can even like sensitize the community. We go to schools and stuff. Then just let them know the need. So you have to know your genotype. Like, it's not a backing up. You have to just know your genotype, no matter what. Wherever the relationship has gotten to, please just check, know your genotype, because that's the whole thing. Then, if for you, not any fault of yours, you were born into into a home where the mother and the father were carriers, that you happen to be the like a sickler because of that, you just have to go with what we've talked about, looking after yourself. You know, some of them, they give up. Yes, because I saw a guy, when you see him, you see that he's a sickler. He was wearing a short knicker with a short shirt, like he was that exposed. So I approached him. I was like, guy, I know you have this. Yeah, I know, but also it will be and I had to really take things to talk with him. He became my friend. When I go there to watch football, I see him, talk with him. Then I saw that like he's now changing Oshinata. Like, very nice guy. Because but I started a saying that he was depressed. He was depressed because of the condition. But me man it has mbisa nindru kra on fat or live normal to the normal person. No. But upon talking with him or starting off and doing there has been changes. And he's even happy about it. Also, sign is the news no more share off and do no. When he's even happy with what he's seeing. So make it enya all is not lost. I have friend. He's outside. He's doing very well. He has the condition, but Osha no do ye. Osha no do ye. The parent na Osha ye. Also when you know we do them, also Osha no do ye. Osha no do ye. Then he's living happily. Then me can no. It will be na shon do ye. Between you na. It's very true. It's very true. But some of them, the pains in taking medication, oil on your come on, what it's okay, but we shouldn't like lose the fight. You should go on. You should go on. All is not lost because it's not easy. Because so now they are trying to get medications about one. So you take some conditions medications no, instead of taking 4, 2, 3, Y and 1, one tab, we were one capsule, then you can offer or you do 3. Medicine is evolving, science is evolving, so they're trying to do such so that we may a drew funnel. Because baby now would default one medication. On here, a drew no, only baby. But why and there or your one? Oh no, obey okay. They'll be far. So I think they shouldn't give up. Shouldn't give up. It's no fault of theirs that they were born a sickler, but they should also fight. Then you can have your life and move on. And who knows? All right.
Doc says you shouldn't give up, even though it's very difficult. You feel like, but don't give up. And also know that sickle cell disease is not a punishment. Okay, it is not a punishment. Neither it is a curse that's obedient toward. It is just a genetic disorder. Nneɛma bi na ankɔ yie. Ɛfa kakra wɔ mama, ɛfa kakra wɔ papa wɔ na we behyia na wɔaba ne dam. So just as Doc is saying, let's not punish ourselves. So let's not think we can't live our normal life. we can live our normal lives, but we should be extra careful on the things we do as we live our normal life. You are normal as every normal person. You are not different at all. So please, let's know our genotype. Let's seek early medical care, and together we can help ourselves and those going through the conditions. God bless you so much, and thank you for staying with us. Don't forget, I'm still your host, Miss Inseidu, and today we completed our discussion about sickle cell diseases, and we were joined to have this conversation by Dr. Isaac Edujemfi. He is a medical officer at Kwesimintim Government Hospital. It was such a great pleasure having you on our show, and we are looking forward to having you same time every Wednesday at 1. Do well to share, to like, and subscribe to all our social media platforms. Let's increase awareness. If we have much information at hand, there's the likelihood of us getting our healing. Okay, thank you. See you. Bye.